Kidney stones can feel like you're being stabbed from the inside. The pain is so intense that many people end up in the emergency room without knowing what hit them. One small stone, sometimes no bigger than a grain of salt, can block your urine flow, damage your kidneys, and leave you screaming in pain. And the scariest part? Most people don't even know they're at risk until it's too late. Why do these stones form in the first place? Is your daily diet putting your kidneys in danger? And what simple habits could be silently leading you toward one of the most painful experiences of your life? In this video, we'll break down everything you need to know, clear symptoms, hidden causes, and the most effective ways to treat and prevent kidney stones before they take control of your health. What are kidney stones? Kidney stones are hard deposits made of minerals and salts that form inside the kidneys. They develop when certain substances like calcium, oxalate, and uric acid become too concentrated in the urine. Over time, these minerals stick together and form crystals. As they grow larger, they can move into the urinary tract and cause severe pain and blockages. There are different types of kidney stones, including calcium stones, uric acid stones, struvite stones, and cystine stones. Each has a different cause and may require a specific treatment approach. Calcium oxalate stones are the most common and usually result from high levels of calcium or oxalate in the urine. Kidney stones can be as small as a grain of sand or as large as a golf ball. Smaller stones may pass on their own with plenty of water, while larger ones may require medical intervention. The key is early detection and understanding what type of stone you have. Symptoms of kidney stones. The symptoms of kidney stones can vary based on the stone's size and location. The most common sign is sudden, intense pain in the lower back or side, often radiating to the lower abdomen or groin. This pain, known as renal colic, can come in waves and may be accompanied by nausea or vomiting. You may also notice changes in your urine. It might appear pink, red, or brown due to the presence of blood. The urine can also become cloudy or have a foul smell. In some cases, you may experience a persistent need to urinate or pain while urinating. If the stone causes an infection or blocks the flow of urine, additional symptoms can include fever, chills, and difficulty passing urine. Any of these signs should not be ignored as complications can escalate quickly. Causes and risk factors. Kidney stones don't just happen randomly. One of the biggest culprits is dehydration. When your body doesn't get enough water, your urine becomes concentrated with waste materials. This thick urine creates the perfect environment for sharp, tiny crystals to form and stick together, eventually becoming stones. Many people don't realize that their daily habit of skipping water or relying on sodas and coffee instead of hydration is silently putting their kidneys under stress. Another major trigger is diet. Eating too much salt, red meat, or processed food can increase the levels of calcium, uric acid, or oxalate in your urine, substances that can lead to stones. Foods like spinach, nuts, beets, chocolate, and energy drinks are high in oxalates, and if you already don't drink enough water, they become even more dangerous. Also, if you have certain health problems like obesity, gout, or chronic digestive issues, your risk becomes much higher due to how your body handles waste and minerals. Lastly, genetics and medications can quietly play a role. If someone in your close family has had kidney stones, you might be more likely to develop them too. Some medications like diuretics, calcium supplements, or certain antacids can affect the chemical balance in your urine, making it easier for stones to form. The good news? Knowing these risk factors gives you the power to make smarter choices before kidney stones start to form. How are kidney stones diagnosed? If you suspect you have a kidney stone, a doctor will begin with a physical exam and a discussion of your symptoms. A urine test can reveal crystals, blood, or signs of infection. Blood tests are also used to check for high levels of minerals like calcium or uric acid. Imaging tests are essential for confirming the presence of a stone and determining its size and location. A CT scan is the most accurate method and can detect even very small stones. In some cases, an ultrasound or X-ray called a cube may also be used. Once diagnosed, the doctor will decide the best treatment plan based on the stone's size, type, and whether it's causing a blockage or infection. Early diagnosis helps prevent complications and reduces the need for more invasive treatment options. The treatment for kidney stones depends on the size and type of the stone. Small stones often pass on their own within a few days or weeks if you drink plenty of fluids. Pain relievers may be prescribed to manage discomfort, and alpha blockers can help relax the muscles in your urinary tract, making it easier to pass the stone. For larger stones that don't pass naturally, several medical procedures may be needed. Extracorporeal shockwave lithotripsy, ESWL, uses sound waves to break stones into smaller pieces. Ureteroscopy involves inserting a thin scope through the urethra to locate and remove or break the stone. If the stone is linked to an infection or is blocking urine flow, immediate treatment is necessary. Antibiotics may be used to clear infections, and a stent may be placed in the ureter to help with urine drainage. Following up with your doctor after treatment is important to prevent recurrence. Prevention tips. The first and most powerful step to prevent kidney stones is simple: drink more water. Staying well hydrated helps flush out minerals before they can clump together and form stones. Aim for at least 8 to 10 glasses of water daily, and if you live in a hot climate or sweat often, you may need even more. Adding lemon water or natural citrus juices to your routine is also helpful. These contain citrate, a natural substance that blocks stone formation and helps break down small crystals. What you eat every day matters, more than most people realize. A low-salt, low-oxalate, and moderate protein diet is key to keeping your kidneys healthy. Limit foods like spinach, nuts, chocolate, red meat, and salty snacks, and focus more on fresh fruits, vegetables, and whole grains. These support your kidneys by reducing waste buildup and improving overall mineral balance. Also, try to get your calcium from natural food sources like dairy instead of relying on supplements, which may increase the chance of stones forming. If you've had kidney stones before, don't wait for a second round to take action. Routine checkups, urine tests, and following your doctor's guidance can catch early signs and stop stones before they grow. In some cases, medications may be prescribed to reduce the substances that form stones. But even small lifestyle habits, like choosing water over soda or adding a serving of veggies to your meals, can go a long way in protecting your kidneys every single day. Kidney stones may be small, but their effects can be huge, causing pain, stress, and serious health problems. The key to avoiding complications is knowing the warning signs and acting quickly. Whether it's through hydration, a healthier diet, or medical care, there are many ways to treat and prevent stones. If you've had a kidney stone before or want to avoid them in the future, the power is in your hands. Simple lifestyle changes and staying informed can go a long way in protecting your kidneys. Have you or someone you know dealt with kidney stones? Share your story in the comments. Don't forget to like, subscribe, and hit the bell for more clear, helpful health guides just like this one.